Hello everyone, my name is Jeanette and I am joined by my colleagues Colleen, Hallie and Beck. Together we will be discussing mandatory reporting. Firstly, I will introduce a case scenario and talk about legislation surrounding mandatory reporting. Hallie will discuss what reasonable belief is, Beck will discuss the process you need to follow, and Colleen will finish off by talking about disclosure. Before we start, I would like to warn you that the presentation does contain shocking and upsetting information, so please feel free to leave the room or take a break if you need to. Let's start with a scenario that took place in our school within the last year. I have changed names to respect the identity of the people involved. Mr. Keane is a physical education teacher who is very friendly with his students and has built a good rapport with them. He finds that students are always able to come to him for support and talk to him openly about things that go on in their lives. One day there was a student who asked Mr. Keane if he could talk to him in private. Mr. Keane, being concerned for the student, took him aside so no one was around to listen in. The student then told Mr. Keane very seriously that he could only tell him this information if he agreed not to tell anyone else. I just want to stop here and ask all of you to put yourselves in this situation. How would you respond if a student asked you to keep a secret? Would you agree to do it? Take a few minutes to think about this and discuss your views with the person beside you. Let's continue the scenario here. Mr. Keane could tell that the student really needed to talk and reluctantly agreed not to tell anyone. The student then confides in Mr. Keane that his father beats him at home and is very aggressive towards him. He explains that he feels like he's doing something wrong and doesn't know what to do to stop his father from hitting him. Mr. Keane notices that there are no outward signs of physical abuse, but is inclined to believe the student. However, he is now worried that if he reports this, his relationship with the student will be ruined, and this could create further problems for the student at home. As you can see from this example, this is a very difficult situation to be in. As a teacher, you need to follow the right processes and policies, but I'm sure that all of you would want to keep the student's best interests at heart. I would like all of you to take a few minutes to think about what you would do in this situation. How would you react? If you have been in this type of situation before, what did you do? Please feel free to discuss these points with the person next to you. Now that you have had a chance to think about the scenario and what you would do or have done in the past, let us explore our next topic, mandatory reporting. According to the Australian Institute of Family Studies, mandatory reporting is a term used to describe legislative requirement imposed on selected classes of people to report cases of child abuse and neglect to government authorities. All Australian states and territories have legislated some laws for mandatory reporting, but they all have some differences in respect to who has to make the report, what types of abuse and neglect have to be reported, and the state of mind that causes reporting. In Victoria, the extent of harm that needs to be reported is when a child has suffered or is likely to suffer significant harm as a result of physical injury or sexual abuse, and the child's parents have not protected or are unlikely to protect the child from harm of that type. The state of mind that causes reporting is belief on reasonable grounds, which is something Hallie will discuss later in the presentation. The Victorian Teaching Profession Code of Conduct also includes mandatory reporting in Principle 3.2. which states teachers are aware of the legal requirements that pertain to their profession. In particular, they are cognizant of their legal requirements in relation to discrimination, harassment and vilification, negligence, mandatory reporting, privacy, occupational health and safety, and teacher registration. Different states also mandate different types of abuse and neglect to be reported. In Victoria, both physical and sexual abuse requires mandatory reporting. However, other types of abuse such as emotional abuse, neglect, medical neglect, and family violence are not mandated, but they still can be reported if there are any concerns for the safety and well-being of the child. The Australian Institute of Family Studies has seen some benefits to mandatory reporting, and research suggests that mandatory reporting makes a substantial contribution to the protection of children and an increase in reports of abuse and neglect. Since its introduction, it has been used as a strategy that acknowledges the prevalence, seriousness, and often hidden nature of child abuse and neglect. And it enables early detection of cases which otherwise may not come to the attention of helping agencies. Mandatory reporting requirements aim to enable professionals to have sufficient training so that they can identify and respond to the cases of child abuse and neglect. It reinforces the moral obligations and responsibilities of professionals and community members to report suspected cases of child abuse and neglect. Mandatory reporting requirements helps create a culture where abuse and neglect of children is not tolerated and is treated very seriously. I will now pass to Hallie, who will speak about reasonable belief.
As teachers, we need to report physical or sexual abuse in under mandatory reporting. However, we need to have reasonable belief that the report is necessary. What does reasonable belief mean? A reasonable belief, or a belief on reasonable grounds, is not the same as having proof, but it is more than mere rumour or speculation. A reasonable belief is formed if a reasonable person in the same position would have formed the belief on the same grounds. As Jeanette has previously stated, the Children, Youth and Families Act 2005 Victoria says the following: if you know that a child has suffered or is likely to suffer significant harm as a result of physical injury or sexual abuse, and the child's parents have not protected or are unlikely to protect the child from harm of that type, in Victoria, teachers legally need to report this to Child Protection. So what is significant harm? Significant is defined in the Cambridge Dictionary as important or noticeable. If you believe that the harm is important or noticeable to the child, which would lead to significant harm, you need to consider fully the previous paragraph. If it is significant harm, you need to report to Child Protection. In what situations has the teacher or principal been caused to have reasonable ground to reasonably believe abuse exists? For one, should a teacher make a report based entirely on the child's word? Yes, this situation is described in the Child Protection document and known as a reasonable belief, as in the first statement below, which I will talk about. All the other following scenarios would be regarded as reasonable belief also. I will list these below. There will be reasonable grounds for forming such a belief if a child or young person states that they have been physically or sexually abused. A child or young person states that they know someone who has been physically or sexually abused. Sometimes the child may be talking about themselves. Someone who knows the child or young person states that the child or young person has been physically or sexually abused. A child shows signs of being physically or sexually abused. and a list of physical and behavioural signs we'll talk about soon. The next one, the staff member is aware of persistent family violence or parental substance misuse, psychiatric illness or intellectual disability that is impacting on the child or young person's safety, stability or development. The staff member observes signs or indicators of abuse, including non-accidental or unexplained injury, persistent neglect, poor care or lack of appropriate supervision. A child's actions or behaviour may place them at risk of significant harm and the child's parents are unwilling or unable to protect the child. Any of those that come up we need to report to Child Protection. So what sorts of injuries or situations are likely to come up and what is physical abuse? Physical abuse could cause an injury and it is not accidental. It has been inflicted on a child by another person. This does not mean a parent can't use reasonable discipline, but they can't use excessive or inappropriate discipline. Next I will refer to Appendix 2 of the Child Protection document, the handout that we have, and we'll talk about physical and sexual abuse and what evidence would show if that was happening. The Child Protection document does say, physical abuse can be beating, shaking, burning and assault with implements. Another form of abuse is exposing the child to extremely dangerous or life-threatening situations. This could mean people who has or will harm the child. Parents sometimes have a condition called fabricated illness syndrome, previously known as Munchausen's syndrome by proxy, which is when the parent causes the child to need treatment by a nurse or doctor by harming or giving them something, for example poison. Therefore the child is being abused and not protected and this must be reported. Some cultures believe in removing partially or fully external female genitalia. This is also regarded as physical abuse in Victoria and comes under mandatory reporting requirements. There are some physical indicators in Appendix 2 in the Child Protection document in our handout that I will briefly mention here. Welts or bruises, especially in the shape of a hand or object that the child may have been injured with, burns that may be suspicious or show the shape of a hot item, fractures that are not able to be explained or the explanation does not make sense, any cuts or grazes especially on the head or genitalia, if there are bite marks or signs that hair has been pulled out, also multiple injuries that could be recent or not. If a child has been poisoned and if they have any signs that they may have internal injuries that need to be checked. There may or may not be behavioural indicators as well, and these are found in Appendix 2 in the Child Protection document handout also. There are many indicators of child abuse and neglect. The presence of a single indicator or even several indicators that I will list soon does not prove that abuse or neglect has occurred. However, the repeated occurrence of one of these indicators or the occurrence of several indicators together should alert teachers to the possibility of child abuse and neglect. If a child has a physical fear or reacts when touched by an adult or may have a lot of clothes on to cover up any injuries, this could mean abuse. Some children don't want to go home after school and some show a minimal reaction when hurt or threatened. Children's attendance may be low due to parents keeping them home until obvious injuries are gone. A child may be shy and overly compliant and not saying much or anything at all. They are scared when other children are upset or loud. They could be aggressive and destructive to themselves or other people while still being nervous or hyperactive. The Child Protection document refers to children excessively friendly with strangers and they may wet or soil their bed. Also having nightmares and being scared in the dark while sleeping at unusual times. Some children find it difficult to remember and concentrate at times. always being sad and crying and possibly even trying to commit suicide. At this point, I will now define sexual abuse. A child is sexually abused when any person uses their authority or power over the child or young person to engage in sexual activity. Child sexual abuse involves a wide range of sexual activity and may include fondling genitals, masturbation, oral sex, vaginal or anal penetration by a finger, penis or any other object, voyeurism and exhibitionism. It can also include exploitation through pornography or prostitution. We have a handout which lists physical indicators and behavioural indicators for sexual abuse, but it also lists those for physical abuse that we have talked about earlier. The handout is Appendix 2, Definition of Child Abuse and Indicators of Harm from the Department of Human Services Child Protection. Thank you for listening to this presentation. We'll move on to the next person now. Thank you.
Given the information provided in our case scenario, it is clear that Mr. Keane has formed a reasonable belief. Once we had this information, as a group, we found it quite easy to establish what to do next, as the guidelines associated with mandatory reporting are very clear. We will now explain our decisions in relation to these guidelines. As it states, if a teacher has developed a reasonable belief that a student has been harmed or is at risk, in accordance with the Children, Youth and Families Act 2005, the following process must be followed in order to comply with mandatory reporting responsibilities. Our first step was to decide on the urgency of the situation. According to the guidelines, if the student is deemed in immediate danger, emergency services should be notified by calling 000. All concerns of severe physical or sexual abuse, including student sexual assault or pornography, must be reported to the Victoria Police Sexual Offences and Child Abuse Investigation Teams on 000. Alternatively, concerns can be reported directly to DAHS Child Protection via the Child Protection Crisis Line on 131278. We decided that in this particular case, an emergency call to 000 was not warranted. Our first point of contact, therefore, would be with the principal of the school. Once again, according to the guidelines, the teacher should disclose all relevant information regarding their beliefs. The conversation should be treated confidentially and discreetly, without the presence of other colleagues unless appropriate. In some cases, it may be necessary to notify a member of the school leadership team rather than the principal. If the principal is unavailable, or you suspect there may be a risk of bias by informing them, it may be more appropriate to consult the vice principal regarding the child. Following consultation with the principal or school leadership staff member, the teacher must make their own decision as to whether a report should be made. If the principal agrees that there is a reasonable belief of abuse, either the teacher or the principal can make a report. Regardless of the opinion of the principal, it remains the teacher's responsibility to report concerns to the appropriate officials if the individual teacher feels there is a reasonable belief. Only one report needs to be made. If the teacher decides not to report, all records should be kept to refer to in the event of future concerns. In this scenario, we decided it would be appropriate to make a report. Throughout the reporting process, it is imperative that comprehensive notes are kept. These notes should include the following information: any information leading to the development of reasonable belief, including student disclosure, observed physical or behavioural indicators, and the source of this information. Any conversations had with the student which may prove relevant, such as a record of the student's claim to the teacher in writing. These conversations should be clearly documented and include the date and time. Other records to keep include the details of the actions taken as a result of the concerns, whether that was consulting with the principal or contacting 000 as the child was in immediate danger. Prepare for the report process by gathering all necessary information. This may include the child or young person's full name, date of birth, and residential address, the details and reasons for the concerns, including your previous records kept, the relevant involvement the teacher has had with the child, whether that's the classroom teacher or other, and the duration of their association, and any details of other agencies who may be involved with the child or family if known, such as DHS or Child First. Once all information is prepared, a report should be made to the local child protection intake provider immediately. The Northern Metropolitan Intake Unit for the Department of Health and Human Services Child Protection can be reached on 1300 664 977. The principal will have a list of contact numbers for other regions. If it is outside of office hours, the teacher should call the After Hours Child Protection on 131 278. If the report is of a non-violent nature, a report can be made through Child First on 1300 721 383. Child First assists vulnerable families by providing advice, support, and links to family services. After filing a report, the teacher should document the date and time the report was given, the name and position of the person who received the report, and a summary of the information given. It is important to notify any relevant staff of the report made to DAHS Child Protection, including the principal, if not previously consulted. The following should also be contacted: the Department Security Service Unit, the relevant regional office, the Student Critical Incident Advisory Unit, and the Conduct and Ethics Branch if a school staff member is involved in the allegations. There are potential consequences of making a report. It is important to note that anyone who makes a report regarding child abuse to Victoria Police or DHHS Child Protection cannot be held legally liable if the report is made with a reasonable belief. The reporter is protected from claims of professional misconduct and breach of ethics, and as such is guaranteed professional protection in accordance with the Children, Youth and Families Act 2005. When making a report, the identity of the reporter will remain confidential unless they provide written consent allowing their identity to be disclosed, or the reporter willingly reveals the report to the child or parent involved. If the court or tribunal deems it necessary for the reporter to give evidence, their identity can be disclosed. As part of the investigation process by DHHS Child Protection and or Victoria Police, interviews with the child or young person may occur at the school without parental consent. It is the responsibility of school staff to have a supportive adult present during any interviews for the child's well-being. The supportive adult may be the teacher who made the report, another teacher in the school, or an administrative staff member. Other responsibilities will include attending DHHS Child Protection case meetings, liaising with professionals, and monitoring the behaviour of the child. We also thought it was very important to recognise that the student will require a lot of support during this process. Whilst it is not the teacher's responsibility to investigate or counsel the child, as a trusted adult in the child's life, support can be provided by observing the child for any indication that they aren't coping. The process of reporting may lead to the child feeling betrayed by the teacher if, as in our case study, the information was disclosed in confidence. The teacher may be worried that the student will lose trust in the teacher and that their rapport will be damaged. It may be hard for the student to understand, but their safety is of utmost importance. The first priority must always be to follow the reporting procedure if a reasonable belief is formed.
Hello, I'm Colleen, and as part of exploring the issues and details involved in mandatory reporting, especially in the example of this particular case study, we thought it was really important to include a section on disclosure and having this sometimes very difficult conversation with students. The first and foremost point to make here is that it is vital for teachers to create a safe and accepting classroom environment so that students feel able to broach and consequently disclose such a private and sensitive subject such as personal abuse. Creating such a safe and nurturing environment clearly relates to the Australian Professional Standards of Teaching 4.4, which states that teachers must ensure students' well-being and safety within school by implementing school and/or system curriculum and legislative requirements. This aspect of teaching behaviour is also clearly explained by the Victorian Teachers Code of Conduct, which states in Part 1.2 that teachers must work to create an environment which promotes mutual respect. It is only in such an environment that a student will feel able and willing to approach an adult to have such a difficult conversation. The next important point to cover is what to do once a student makes this difficult first step. According to the Department of Human Services and Joe Tucci from the Australian Childhood Foundation, it is vital that the teacher stays calm and does not let their emotions show during the conversation. The children needs to feel confident that the teacher is strong and will be able to listen and help. It is important at this point that the teacher does not overreact or talk about their own feelings or emotions. This part of the process ties in with the Code of Conduct section 1.4, which states that a teacher must maintain objectivity in their relationships and act in the best interests of the child. By behaving compassionately but professionally at this time, the teacher can reassure the student that their conversation is being taken seriously and treated appropriately. As the student is opening up to the teacher, it is vital to remember that it is never the teacher's role to become an investigator or interrogator. John Roberts, a student wellbeing officer from Northern Melbourne, explains that this is because of a number of reasons. The first being that to explain and talk about such events can be quite traumatic for some children, and as they will often be required to repeat all the details to the incoming investigator, it is crucial that this trauma is minimised where possible. The second reason is that police officers and child welfare officers are especially trained in this area and can much more sensitively and appropriately gain the necessary information they need. The third and equally important reason is that in some instances the information gained by untrained staff can be used against the child in court as an argument of tampering with the evidence or leading the witness. It is not the teacher's role to get the evidence. As Hallie mentioned previously, forming a reasonable belief can be done purely by hearing a child state that they have been abused. The teacher does not have to prove it or have evidence. It is therefore important that the person listening to the student does not ask probing questions or expect the student to reveal more than they want to. It can be difficult at this stage to know exactly how long to let the conversation go, and in many ways this part of the process requires sound professional judgment and the teacher's knowledge of their students. If the child appears to want to talk, then the teacher should be patient and let them. However, if it appears difficult for the student, then the minimal amount of information discussed is appropriate. Once the student has disclosed the necessary information, it is then really important for the teacher to let them know that they've done nothing wrong and that they believe them. Students will require a lot of reassurance at this stage, but an important point for the teacher to remember is never to promise confidentiality. Because of mandatory reporting and probably their own professional judgment, this is a promise that the teacher will not be able to keep. So honesty at this point is vital. Instead, the teacher should reassure the students that they are there to help them and will support them with whatever comes next. Confidentiality is an important aspect involved in mandatory reporting, and teachers need to have a solid understanding of what is involved when it comes to such a difficult area. According to the Victorian State Government's School Policy and Advisory Guide, the teacher must disclose the information to the relevant authorities if they have formed a reasonable belief that the child is in need of protection. they are encouraged to discuss their belief with more senior members of staff before reporting it to these authorities. However, this does not mean having a quick debrief over morning tea with whoever they're speaking. As highlighted in the Code of Conduct, the teacher must respect a student's privacy in sensitive matters and only reveal confidential matters when appropriate, such as when, in this case, it is mandated by law. It is vital for the teacher to remember that the consequent conversations only take place with those who should be involved, and should avoid discussing the student's personal problems in situations where the information will not be treated confidentially, as outlined in the Code of Conduct 1.2. Handling this conversation well is a really important part of acting professionally, and this is clearly explained in the Victorian Teachers Code of Ethics. By listening objectively, compassionately, and respectfully, the teacher can demonstrate their integrity by acting in the best interest of the student, by acting in the best respect of the student, and by acting with care and compassion. At this point, having covered so many aspects surrounding the issue of mandatory reporting, I'd like you all to revisit the case study we started with. In a moment, I'd like you all to stand up, move around, and find the person or people you discussed the case with at the start of the session. Have another quick discussion related to our particular case. Would you do anything differently than you would have before? What have you learned today that has made you rethink how you would act in such a situation? Are there aspects which still cause you some concern or uncertainty? We'll give you about 10 minutes and then we would really like to finish with a quick group discussion about what we've all learned today. If nothing else from what we've learned today, I think we could all agree that this would be a very difficult situation to be in as a teacher. However, if we follow the law, the guidelines and the school policies associated with mandatory reporting, we can hopefully minimise our own distress and help our students in the best possible way, which of course is what we set out to achieve every day. Thank you.